Okay. Okay. Yeah.
The open mouth. No, so no, this was actually going, bro. The open mouth, the open mouth, you open it, you say and then you go. The serious you go from the inside to the back in the back. You gotta go hold like. You see back and say Look, bro, you're supposed to say
We don't have them keep them out with this. Like, we're about to. No.
Yeah, no, like.
Okay, we're gonna start with lateral. As you can see, lateral and oblique for C-spine is at 72-inch SID. Okay, so those are the only two that are at 72-inch, so we're gonna start with those. Lateral, you wanna make sure you're detented, guys, please. Detent the machine. Can I get somebody? Okay, so you're gonna have the patient remove, ideally, everything in this area, including earrings, including dental work, if they have dentures or any of that stuff. Anything that's removable, have them remove up in this area, okay? Then you're gonna have them do a left lateral. So you're gonna be turning this way, right here. Again, no kneeling, no any of that stuff. We're gonna stand exactly straight. And then our CR gonna be C4. That's gonna be a little bit like at the jugular notch. I think it's over, yeah.
Wait, is this a lateral cervical?
Yes.
Oh,
okay. Okay, I would say we're gonna match our board. And then you're gonna have the patient exactly in the middle, the mid-sagittal. You don't want to cut off any side of their spine, okay? I should be able to see the front and the back. The top of the light should be at the EAM. Let's go up right there. And then into the shoulder, perfectly fine. This is an amazing left lateral C-spine, okay? Obviously, throw a marker on it. Okay, next we're gonna do the obliques. Okay, there's two ways that you can do obliques. He's giving you both options, right? For the final. Okay, so LPO. Cool. Again, this is gonna be at the same CR. You're just gonna turn your patient to a 45-degree angle and then turn their head slightly like that. Okay? Easy? Questions? No. Okay.
So that one we don't have to do the angulation?
Yes, you do. Oh my God, I totally forgot. Okay, totally forgot. See? Yes, 15 to 20 degrees. Yes. There we go. Someone did their homework. Okay, so 15 to 20 degrees up if they're facing you, 15 to 20 degrees down if they're the other way, okay?
Where are we going?
Right there. Okay, again, always make sure that they're in the center, and I want to see light on both sides. Okay, then we're gonna do, so if you do that, then you don't have to do the 10 to 15 degrees down. which is when they are turned come on, dude. Like that, and then let's go. Okay, and then the opposite way. And then chin, not chin back, but chin to the side. Good, like that. Okay, so everyone's neck is very different. Mid-neck, okay? That's where C4 is. Because some people's necks are long, some people's necks are not even, you know? Yeah, so go to the middle of the neck. That's where C4 is. Yes. Okay. Yes, these are 72. The obliques and the lateral, 72. Once you finish those is when you go to the 40. April, you have a question. What is it?
Because it says the caudate angle is required for anterior.
Yeah. Down.
Okay, gotcha. Gotcha. I was getting confused.
Like that when they're pointed. But when they're facing you, it's going up. When they're facing the wall, you're going down.
Well, isn't anterior facing us?
No. This is anterior. He's in a, right now he's in an RAO. What? Yeah, he's in an RAO. His right chest is on, his right shoulder is on it.
So it's different than when we do like a like a posterior chest. It's like this is PA and this is AP. That's where I'm being confused.
I'll get back to you on that.
Okay.
Okay, so now we're gonna do AP is gonna be a 45 degrees going up. 15. And then you're gonna go to C4, which is right.
This is an AP axial cervical.
Yes. Right there. You're gonna have his back all the way against the board. You're gonna have his chin not all the way back because you don't want the occipital bone to cover, but just slightly. Beautiful. Got it? 15 up for an AP. Now we're gonna do the open mouth. You're gonna decrease your collimation before you even go up because you don't want to blind your patient. You're gonna tell your patient that there's gonna be, I'm not even at 40 inches.
Quick picture. I just want to see the image. Look over here. TJ, right here. Yeah. When he says
Are they bullying you? Mm-hmm. Okay. This part is very important. They need to be exactly straight because if they're too back, if their head is too back, the occipital bone will cover the dens. And if they're too forward, their teeth are going to cover the dens. So they need to be perfect. Okay? I'm going to show you guys. Have you guys seen a picture of what it's supposed to look like? Like this. I'm supposed to see all of this. This is their teeth. This is what I'm supposed to see.
That's the sorry, that's a C1 and C2.
Yes. Okay, open, open, open.
Good job.
Okay. And that is
also, it's
the
like
open mouth.
right on the inside of his, on the top part of his like teeth.
No, it's not. It's shooting straight in the middle.
And his tongue's depressed.
Yeah, I mean, X-ray's gonna shoot right through it, so it doesn't matter.
Just tell our patient,
Yeah.
Come on, bro.
Okay, close your mouth. Okay. This is, C-spine is all preferably upright or sitting and then, T-spine is preferably laying down.
Supine, right?
Yes, supine.
Bucky.
Yes. Okay, so we'll do that one. Any questions on C-spine?
I feel pretty confident actually. No, I'm being so for real. Like I actually feel pretty confident.
Good.
Just looking at it on the video.
And then I'll show you guys pictures of what they're supposed to look like. Oh, for the lateral, very important that the shoulders are depressed down. A lot of times they try to do this. I don't want to see shoulder. I want to see as much of the neck as I can, okay?
If you want to depress the shoulders a little more, they use sandbags. I was looking at Clover on that. Typically, I believe you don't do that, right?
Yeah, we don't typically do that. If you can't get open mouth, then there's a Fuchs method where their head is back and then you're shooting through their
mentis.
Yes.
Mental.
So you're going basically, you're getting right there, and then there's no angulation. Pretty sure there's supposed to be an angulation. Right there, I would get it. But typically, open mouth should work. Get used to doing open mouth. It's very fun. Once you get it, you're like, whoa, you know? Okay, T-spine. Let's get on the bed. Let me get a sheet, though. Hold on. I have no idea. Oh, repeats I think are on Wednesday. If you need to repeat your midterm, I think it's on Wednesday.
All of this is for the final. There's a different position.
For week one? He wants to know if what we did for our other midterm
It's
is gonna be
from
on.
chapters 8 to 11.
We gotta look at this bad boy.
So no, it's not the from the beginning. Okay, on the bed, please. Okay, guys, very important that you don't put the pillow underneath their shoulders. You only put it underneath their head, specifically for the T-spine, because we just don't want it to be in the,
So the
yes.
pillow should be a little bit above the head.
Yeah, like, that's perfect, just not under the shoulders.
Okay. It's a 14 by 17?
Yes.
Lane crosswise. Lengthwise on the timeline.
What do you mean? Landscape or portrait? Portrait.
Guys, let's imagine we're trying to get the full T-spine, so we're gonna go portrait. When your bone is long, whatever is long, you're gonna go portrait. When we're going big, then we're gonna open. Okay. Okay, CR is at T7. We should all be familiar with T7. Yeah. Okay, match up your tube. Beautiful.
Which one's the one where the CR is between the jugular notch and the xiphoid process? Is it the same thing or no?
Yeah, this is the jugular notch and this is your xiphoid process. Okay, let's just a tad. Okay, we want to come back over here, make sure that we're exactly at the mid-sagittal. Right there is the middle. This is our AP T-spine. You're going to center to C7, 40-inch SID, 14 by 17 portrait.
Beautiful. Question.
Yes.
As far as collimation goes,
yes.
How do you know exactly as far as side to side? 2 inches side to side, right?
How do you
know exactly it's 2 inches though?
Yeah. Just eyeball it because you're just trying to get the spine. As long as I see the bony, just the spine, that's all I need. I don't need lungs. This is their lungs. I don't need all that. This is exactly where his spine is.
And are we supposed to bend the knees to reduce the OID?
Oh, yes. People don't usually do that, but you can bend this. to make sure that the arch of the back is now flat. Okay. Next, we're gonna do lateral. So you're gonna turn towards me.
Is it recumbent or is this all depending on what?
Over my head real quick.
Yeah. And then you want to make sure that he's perfectly straight. Want to make sure that the knees are bent. Guys, the spine is in the back, so I don't need this. I just need to push a little
Also, it's Corona, yeah, Corona.
right there. And then I'm gonna go up the top and let me see the back. Beautiful. Like that.
And then these are all shielded besides like the lumbar and the sacrum. Right?
Yes.
Obviously.
C-spine and T-spine all shielded. The shield the gonads. Is swimmer's view on the... Do we have to do a swimmer's view?
I don't know. Sometimes they name it something else. You know, they name it the real name. And I don't know.
It says cervical thoracic.
Okay, yeah, he doesn't have swimmer's view. Okay, so I want to talk to you guys about swimmer's view because most likely in your clinical sites and your hospital, you will need to do that. You're going to have the patient bring this arm down. Then they're going to bring this arm exactly underneath their head. Did Clover show you guys this or no?
Yeah.
Oh, they did. Okay, perfect. I don't know why.
Boring though, but
Okay, I hope I'm not boring.
whatever.
Okay, and then...
The coffee you drink too is about it.
Oh, was it 7-Eleven you said?
What?
good?
Boy, head
Or-
down.
Okay.
No talking patient.
Okay, and then you shoot that. Okay,
You have the C7, right?
C7.
Or no, am I wrong?
Is it at C7?
With the shoulder depressed, it should be offset. They
Okay.
don't bless, more alive.
It says T1, T7.
Okay.
But they, the one day she did it in
I don't,
Colorado was standing, so that had an
Yeah.
angulation.
Yeah.
So this would not be angulation.
No, I don't angle for this.
Okay, but if it was standing, then we have to angle a little bit.
Yeah.
3 to 5.
Yeah. I know that it's not on our final or whatever, but know it because every hospital is going to make you do it with your, you know, it's always at like, it's a part of their routine typically.
Okay.
So, yep. Questions? Here, let me move this out of your way. Patient safety. Let's talk about that. Move your tube out of the patient's way. Yes, you can get out. Typically, when we do a C-spine, they're going to be collared. It is not our job to take the collar off. We don't touch that. We don't mess with the patient at all. Whatever nurses and doctors have done to the patient, not on us, okay? A lot of the times, because of their collar, they can't take off their necklaces or whatever. Try your best to remove whatever you can remove. Obviously, don't go into their mouth and take their dentures, but whatever you can remove, remove it. You can ask your nurse or whoever ordered the order if they can remove anything that can be removed. Other than that, you don't remove anything. And that's it. Patient safety is very important, guys. Please don't drop your patients. Also, everything can be done portably, so same thing, same angles, same everything, just with the board right behind, not in a bucky. Okay, any questions, comments, concerns?
What was the SID for that last one?
40.
And for standing it'd be 72.
40 or 72, okay. Cool. They say the same thing about oblique. It's between 40 to 72 in your book. Do 72. The more SID, the better for you. So do that. When it gives you a range, 40 to 72, then do the most. Oblique, it gives you the range, so do the most.
I'm ready.
Okay, cool. Have fun, guys. I will be right there. And I'll get back to you about the RAO LPO stuff.
I just want to make sure because I think I was getting confused because everything's a little flipped on the other stuff.
Yeah, I always just memorized it. That's why
Well, that's what I end up having to do. That's why I'm like, okay, so what is it? So that I can just, because I think it's opposite than it was before.